Let me ask you a simple question. Have you ever walked into your poultry house, looked at your birds, and something just didn't feel right? They're quiet. Some are gasping. One is passing green diarrhea. Another one is twisting its neck. At that moment, what comes to your mind? Because if you miss it, you could lose the entire flock. Today, let's talk about something every poultry farmer must understand: Newcastle disease. Now listen, Newcastle disease is not just any disease. It is one of the most important and devastating viral diseases of poultry worldwide. It affects both commercial and backyard birds and causes serious economic losses due to high mortality, reduced production, and even trade restrictions. So yes, this is a big one. Exposure of humans to infected birds can cause mild conjunctivitis and influenza-like symptoms. So, what exactly is behind all this? It is caused by Newcastle disease virus, NDV. Now you may be wondering, how did it even get into my farm? Very simple, and that's the problem. It spreads easily. Direct contact with infected birds, droppings, secretions, airborne spread, especially in intensive systems. Contaminated feed, water, equipment, clothing. And yes, wild birds can act as reservoirs, so even your boots can carry this virus. Now this is the part I want you to pay very close attention to, because this is how you detect the disease early. Clinical signs will vary depending on virus strain, age of birds, immune status, environmental conditions, respiratory signs. First, look at how your birds are breathing. Are they gasping and coughing, sneezing, having nasal discharge, producing abnormal breathing sounds, what we call rales? If breathing becomes a struggle, something is wrong. Digestive signs now. Check the droppings. Let me ask you, have you seen greenish watery diarrhea? Because that one is very characteristic. Also look for loss of appetite, rapid weight loss. That green diarrhea is not something to ignore. Nervous signs, very important. Now this is where most farmers become alarmed. You may suddenly see a bird twisting its neck. Let me repeat, twisting its neck. That is torticollis. And it doesn't end there. J, paralysis of wings and legs, tremors, circling movement, incoordination. These signs are especially seen in survivors or later stages. At this point, the disease has already caused serious damage. Reproductive signs. If you are into layers, this is where the loss hits your pocket directly. You'll notice sudden drop in egg production, soft-shelled or shellless eggs, misshapen eggs, poor egg quality. So even when birds survive, productivity drops. General signs. Now take a step back and just observe the flock. Do they look normal? Or do you see depression and weakness, ruffled feathers, swollen head, high mortality, sometimes up to 100%? Yes, you can lose everything. Now let's be honest, this is the question every farmer wants answered. Doctor, what do I use to treat it? Here's the truth. There is no specific treatment for Newcastle disease because it is a viral infection, but don't switch off. There is still something you can do. Supportive therapy. You support the birds, multivitamins, electrolytes to reduce dehydration, antibiotics, supportive use only. Yes, you can use antibiotics, but understand why. They are used to control secondary bacterial infections, common options, enrofloxacin and amoxicillin. And don't forget, antibiotics do not kill the virus. Environmental management. Sometimes the simplest things matter most. Reduce stress, heat, overcrowding. Ensure proper ventilation. Provide clean water at all times. At this point, you should already be thinking, prevention is better. And you are absolutely right. Vaccination. This is your strongest weapon. Most effective control method. Use vaccines like Lasota, Nucavac, Hitchner, B1. But don't just vaccinate. Follow the correct national schedule. Biosecurity. Let me ask you, who walks into your farm? because that matters. Restrict farm access, disinfect equipment and vehicles, use foot baths, avoid mixing birds of different ages. Quarantine. Isolate new birds before introducing into the flock. Simple, but powerful. And your best defense is vaccination and biosecurity. So next time you walk into your poultry house and something feels off, don't ignore it. Look closely, act quickly. Because in poultry production, timing is everything. If this helped you, subscribe to the Poultry Vet Doctor channel. Let's fix your poultry problems, one disease at a time.